It's almost like this should be a no-brainer. I mean, this should be, we breathe air, take antibiotics if we have an infection. We wear seat belts. To wear a seatbelt doesn't mean that we're promoting fast driving. To wear a seatbelt means that we're going to protect you.
I would think that the most important reproductive health issue in South Carolina right now is comprehensive sex education.
As an educator, I believe that it is very important for age-appropriate sex education be taught and emphasized in the public school curriculum.
To support a comprehensive program is not to encourage inappropriate sexual activity. It is a response to what our youth are doing today and what people do.
We can't assume that these children are getting research-based, conscientious, well thought out and prepared sexual health education from home.
Knowledge is power, and if you go in and understand what you're saying and understand what you're doing and know your choices, then you are going to make the better choice.
Just say no, I think may work for some people, but I certainly want my children and my grandchildren to have more information than this.
Yes, we can still promote abstinence, but the reality is when you look at some of the statistics that we're going to have a two-prong approach or a multidimensional approach to reproductive health education for our children.
Sex education needs to happen in every school in South Carolina, and it needs to be comprehensive.
I found it really distressing that for several years our state put all of our funding in sex ed towards abstinence only. And I have to believe that that was money wasted. I would like to see the whole array of options offered.
Abstinence should be a component of every comprehensive sex education, and in fact, abstinence should be taught. That is preferable. But at the same time, we also need to face the realities that we have high teen pregnancy rates, that teens are having sex, and that we also need to teach them, if they choose to have sex, how to be responsible in doing it.
We can turn away and pretend like this is not an issue that's impacting our communities and our children, but the realities are that we need to sound the alarm. We're in crisis mode, and everybody is going to need to rally around this cause and have all hands on deck from all different levels, from the State House all the way down to the church house.
Don't be afraid. I think a lot of women don't get involved in this issue because they're somehow afraid of talking about women's reproductive health, perhaps.
There should be nothing controversial about it. It is what it is.